11 days after the nationwide strike by the Nigerian Association of Resident Doctors, NARD, began, patients across the country continue to suffer as medical services remain paralyzed in at least 91 healthcare facilities. About 11,500 resident doctors, who make up a significant portion of the country's 56,000 registered medical practitioners, remain on strike over unaddressed issues like unpaid arrears, poor working conditions, inadequate staffing, excessive workload, and the lack of essential medical infrastructure. NARD President Dr. Muhammad Suleiman told News Central that the strike will continue until all 19 outstanding demands are met. However, unconfirmed reports say the federal government is holding a reconciliatory meeting with NARD in an effort to end the ongoing indefinite strike by resident doctors. The meeting was allegedly jointly led by the Ministries of Labor and Health in Abuja on Monday. Are these talks confirmed, and will these talks lead to a positive result and an end to the strike? Well, let's find out as we are joined by the president of the Nigerian Association of Resident Doctors, NARD, Dr. Muhammad Suleiman. Thank you very much for joining us. Good morning. Our last conversation with you was very passionate, heartfelt, and painful to hear the realities of the everyday doctor in Nigeria. We know that the strike commenced on the 1st of November, but the question now is, are there really ongoing strikes between NARD and the federal government? Ongoing talks, rather.
Yes, I can confirm to you that we have been talking. Like you said, we have been talking, and I must commend the Minister for Labor, the Honorable Minister for Labor. He has taken it upon himself to see that he brings in every agency and aspect of government that has one thing or the other to do with our demands. I must also praise the Honorable Minister for Finance, who has diligently worked to see that the issues on his table are receiving the attention that they need. And at this point, I have to say a very big thank you to the Honorable Minister of State for Health, Dr. Isiaka Adekunle Salako. He has met with us severally. We have discussed all the issues. Now, here is where the meat of the matter is. Every item on the 19-point demand has been agreed upon by every stakeholder, not just people in the executive arm of the government, but even in the National Assembly, that these are germane, these are genuine, this must be addressed. For instance, the 25-35% arrears that was released to the tune of 41.3 billion over a period of 3 months that started in August has still not gotten to almost 40% of our members. Just about 60% have received it. Where government is still scrambling, working around to see why such is happening and then how that can be rectified. For instance, the accoutrement allowance, which is about 2.9 billion, the clinical duty allowance, which is 2.4, and the COVID-19 arrears for Juhesu, which is just about 400 million, constituting about 6 billion. We just got confirmation. It was supposed to be released last Monday. We just got confirmation that it was released yesterday. Plans to pay are ongoing. We're expecting it today, you know. And there's this confusion that it was 11.9 billion, and then it was dragged across media and the social media space that 11.9995 was released for accoutrement allowance. This is not so. You know, then when you look at other issues like Lokoja 5, they are still not reinstated. I mean, there are conversations that, yes, they need to be reinstated. You know, and we're waiting for the action to come for them to be reinstated. There's the issue of the professional allowance table. Now, you need to understand that whenever minimum wage is adjusted in this country, doctors in Nigeria have an agreement with the federal government that once the basic salary is adjusted, the allowances should be adjusted to. This has not been done since 2019. Government agrees that it needs to be done. Government has done the adjustment. The tables are ready. Release the table so that this can be implemented, you know, and then we're just dragging, for lack of a better.
Now, Dr. Suleiman,
you know, so I can go on and on and on. Specialist allowances there. You know, there are allowances in FMC or in OATC Ile-Ife. We're just talking about compilation now to see the quantum of what it is. These people have rendered these services years ago, months ago, and their pay has not really reached them. So yes, there are conversations, And it is our hope that it won't just be conversations. It will be things put to finality, things put to paper, signed, agreed, circulars released, monies released, actions taken. In fact, we're not so much particularly interested in what government wants to do about it. We're interested in government doing what it needs to do about these things.
Okay, so just for confirmation and clarity, you've met with the federal government, the monies have been approved, all 19-point demands have been met.
No.
Okay.
All 19-point demands have not been met.
But they've agreed that they're germane.
Yes, they've agreed that it must be solved.
Okay.
And then we're discussing how to solve them.
So where are we now? If there was to be a checkbox of the 19 demands, which ones have been met? And how many are you satisfied with?
Yes. No, permit me to have a lot of respect for the officers of the federal government who have shown genuine commitment to solving these problems. For instance, officers from the Salaries and Wages Commission, officers from the Accountant General's Office, officers from even the Federal Ministry of Health. Now, it's not enough to say, let's solve them. It's not enough to say, this is how to solve them. It's acting to solve them. It is these promises in the past that have been failed to be acted upon that is now the germane issue. So government knows, all the people we are talking to know that it is time for us to take action on all of these things. Now imagine you are my NEC member, and I now come and tell you, my distinguished NEC member, the government has said on the professional allowance table, yes, it has agreed that an injustice has been done for over 7 years. Yes, it has been agreed that only about 45% of your salary, of your allowance, has been paid to you over the last 7 years. Government has agreed, but government has said, okay, release of this table, you have to wait until another 2, 3, 4 months process is completed. I mean, that NEC member is going to be livid. For instance, you tell our colleagues in Lokoja, our government has agreed that, okay, you need to be reinstated. Okay, you now have to wait for government, or you have to take up locum appointments elsewhere. There's nothing we can do about it for now. You have to wait until maybe 6 months, 5 months from now. It's another promise. We're now telling government, you have to practicalize it. Action steps must be taken.
Okay, let's talk about also, just to clarify, where we are regarding the strike. Is the strike over? Is it partially lifted? What's the situation regarding the strike?
No, we're still on strike. It is total, it is comprehensive, it is indefinite. Indefinite until government has met its own side of the bargain in all these issues. Remember, there's no issue that is less than a year old. Let me give you another instance. We have registrars who have written Part 1 exams who are supposed to be upgraded to Senior Registrar 2 status. Now, after 1 year, you're supposed to also upgrade that Senior Registrar 2 to Senior Registrar 1. That is 2 upgrades within a period of 1 year because of a professional qualification. As I'm talking to you, for over a year, these upgrades have not been done. Now, people have missed 2 upgrades. There are arrears attached to it. You can't simply say, okay, we agree that this is a problem. Okay, let us now take time and go and solve it. No, you have to solve it now. That upgrade needs to happen now. Perhaps the NEC of NARD will now say, okay, since you've done the upgrade, let us now see when you can pay the arrears attached. Let me give you another instance. The entry level into civil service for medical doctors is COMMES 3. This year, appointment letters have been given, alerts have been received, salaries have been paid at COMMES 2. This is a whole 100,000 naira less than what the salary ought to be, simply because someone decided that we have to take these doctors from COMMES 3 down to COMMES 2. This is something that has been dealt with more than 10 years ago, agreed upon. Everyone knows that, but someone just woke up, and even in the conversations, everyone acknowledges that that was a mistake. That was a clear mistake. Now, those doctors, some of them have been working for almost a year, some for 6 months, and I can tell you, FMPH Barnawa, UITH Ilorin, I can tell you UUTH, I can tell you different institutions, even National Hospital Abuja, where these doctors have been placed on COMMES 2 and they are being paid salary at this level. It is not enough to say, somebody made a mistake, it is wrong. No. Okay. You have to correct it. There are accrued arrears. Now, those conversations have to happen in that line. It's not just acknowledging, we've discussed, okay, we agree it's a problem. No, you have to solve it.
So, Dr. Suleiman, you've been in constant communication with the government side, the stakeholders. You've given credit.
We are in communication. Putting constant is taking it to another level.
Okay, you've been in communication.
Yes,
Let's be clear in our use of language. And
this is the 11.
Yes, and you've said
I have discussed with the Minister of Labour twice, with the Minister of Finance once, with the Minister of State for Health twice. My team, that's the team from the National Council of Resident Doctors. When you say constant, it means we are constantly talking.
Okay.
So,
in day 11,
meetings, just to confirm.
Yes, day 11 today.
Day 11, you've had 5 meetings, and a lot of people will say...
We've had 2 meetings with these officers.
Okay, 2 meetings. But a lot of people will say progress is being made, and you've also alluded and you've given credit to some of the officers that work for this federal government.
They've actually shown genuine commitment to solve
federal
the
government agencies. I mean, looking at how critical health is to a nation, and the fact that you and your colleagues took the Hippocratic oath to, save lives and workers, doctors. Don't you think meeting each other halfway and calling off the strike would, since they showed genuine commitment to attending to all your grievances and your 19 demands, it's high time you call off the strike? Or you don't trust them enough?
I appreciate your question, and I think your question is germane, and I think your question is valid. There's nothing wrong in looking at it from that perspective. But I'd like to call your attention to 2 aspects of that. That Hippocratic oath that you mentioned, if you have read all of it, there's also an aspect of physician heal thyself. In one of our meetings, I made it clear, we have a colleague that finished a 3-day straight call and was driving home, and he had an accident. That accident took his life. I wouldn't want to mention his name. If you follow social media very closely, I don't want to revisit the pain to his family. We have another colleague who, after taking a 2-day straight call, collapsed, became unconscious. A CT scan was done. He has bled into his brain because of what is known as a ruptured aneurysm in his brain. He was in ICU and he eventually died. These are work-related problems. I told you about how one person will be taking calls every day. What that means is that you're exhausted. What that means is that your ability to critically take decisions at critical points for patients is impaired. That Hippocratic oath, if I am a Muslim, I swore with the Holy Quran. Christians swear with the Holy Bible. At the end of the day, you're accountable not just to the laws of man on earth, you're accountable to the laws of God. Sometimes when you are arrested, you recall some of these decisions that you have taken, and you're less than sure whether it is appropriate. We don't want Nigerians to be exposed to this kind of hazards. We are exposed to hazards at work. We are exposed to exhaustion, frustrations, a lack of professional progression, and then this contributes. You are human, you're not a machine. Your brain has a limbic system, your brain has places where it processes emotions. And at some level, this will play in your decision. We don't want Nigerians to be exposed to this. It is not asking for too much for these actions to be taken to resolve these problems. That is why we took a whole 6 weeks, after 2 weeks, after 30 days, another 1 week, talking to Nigerians about this issue. It is crystal clear. Now, with respect to government showing genuine commitment, I will not sit down here and say the Minister of Labour is not passionate about solving these problems. He is. He's a father to the nation. He's a father to doctors. I won't sit here and say the Minister of Finance hasn't shown commitment. But out of the 19 points, how many have been taken to a finality? It is not a reconciliation because we are not married. It's a conciliation where we look at it, we look at how to solve it. Now, these solutions, are they fully out? No. Have we fully agreed on implementing these solutions? No. What are the critical points? It is left for the conciliation to end on it.
Okay, this might be a place where we'll come to the end of the conversation today. We do look forward to a profitable middle point that the government and NARD can find, a soft point, because at the end of the day, they say when 2 elephants fight, it's the grass that suffers. So we want you back in our hospitals. We miss you people. We want to be be able to come to the hospitals and have you attend to us.
Doctors are dying in this country.
And we want, yes, I
understand.
understand. And we want your welfare to be prioritized as well, which is why we're hoping that sooner than later, these needs can be met and we can return to.
Thank you for that. We really appreciate it.
And thank you for fighting the good fight, because it's for the future of healthcare in Nigeria, not just this
Thank you very
time
much,
around. Thank you so much.
Thank you so much for joining us.
All right.
Sorry.